Anxiety. Although as, if not more common than depression, often seems to receive less attention and can often be left undetected and is often undertreated. Do you think you're suffering from anxiety? Have you seen your doctor or local health professional about what you think might be anxiety? If you have, then you may be familiar with the GAD-7. The GAD-7 is an easy-to-use, self-administered questionnaire and is commonly used by medical professionals as a screening tool and measure of the severity for generalized anxiety disorder, or GAD. Initially validated in over 2,000 patients as a diagnostic tool for generalized anxiety disorder, the GAD-7 was also later found to have reasonable sensitivity and specificity as a screening tool for panic disorder, social phobia, and PTSD. See the link below to the study publications in the video description. Please note, this tool can be used for screening and monitoring symptom severity. It cannot replace a clinical assessment and additional evaluation to confirm a patient diagnosis. The GAD-7 is recommended to be completed by individuals aged 16 or over. So, what is the purpose of the GAD-7 questionnaire? The GAD-7 is commonly used by therapists and professionals to initially determine a patient's symptom severity and is then usually repeated at a later date to monitor any symptom changes in response to treatments received over time. The questionnaire itself is widely available over the internet, and we can bring you the questions right now. So if you'd like to continue with the test, take a moment to grab a pencil and a piece of paper to write down your answers to the following 7 questions. All 7 of the questions come with 4 possible answers, with those answers being A, not at all, B, several days, C, more than half the days, or D, nearly every day. And all 7 questions are to be considered from within a time period of the previous 2 weeks. If you've got your pencil ready, let's take a look. Question 1. During the last 2 weeks, how often have you been bothered by feeling nervous, anxious, or on edge? A, not at all. B, several days, C, more than half the days, or D, nearly every day. Mark A, B, C, or D on your paper. Question 2. Again, during the last 2 weeks, how often have you been bothered by not being able to stop or control worrying? A, not at all. B, several days, C, more than half the days, or D, nearly every day. Question 3. During the last 2 weeks, how often have you been bothered by worrying too much about different things? A, not at all. B, several days, C, more than half the days, or D, nearly every day. Question 4. During the last 2 weeks, how often have you been bothered by having trouble relaxing? A, not at all. B, several days. C, more than half the days. Or D, nearly every day. Question 5. During the last 2 weeks, how often have you been bothered by being so restless that it's hard to sit still? A, not at all. B, several days. C, more than half the days. Or D, nearly every day. Question 6. During the last 2 weeks, how often have you been bothered by becoming easily annoyed or irritable? A, not at all. B, several days. C, more than half the days. Or D, nearly every day. And question 7. During the last 2 weeks, how often have you been bothered by feeling afraid as if something awful might happen? A. Not at all. B. Several days. C. More than half the days. Or D. Nearly every day. Okay, so now we've reached the end of the GAD-7 questionnaire. It's time to take a look at the results. And the results of this screening tool are really simple to work out. If you've answered any of the questions with the letter A, not at all, mark that with a 0. If you answered B, several days, mark those with a 1. If you answered C to any of the questions, more than half the days, those are scored with a 2. And if you answered D to any question, nearly every day, mark those with a 3. So answers A, 0, answers B, 1, any questions answered with C is 2, and finally D is 3. So the minimum score you can attain is 0 and the maximum 21. Once you've scored all 7 of the questions, add up your score and take a look here at what the professionals say. If you scored between 5 and 9 on the GAD-7 questionnaire, you may be suffering with mild anxiety. If you scored between 10 and 14, then you may be suffering from moderate anxiety. And if you scored anything above 15 in the GAD-7 questionnaire, you're likely to be suffering from what is considered severe anxiety. And for all results in the GAD-7, it's important to remember that this screening tool is not to be used as a replacement for professional help and diagnosis. If you're concerned about how you feel at any time, you should seek proper assistance. And our advice? If you scored up to 9 on the questionnaire, you may choose to simply monitor your current situation, perhaps retake the test in a week or so and see if there are any noticeable changes. If you score 10 or over, it's recommended that you see your GP or healthcare professional for further evaluation at the nearest opportunity. Remember, you're not alone in suffering with anxiety. There are millions of sufferers worldwide who can relate, and many of them will be able to overcome their anxiety problems over time with the right guidance and support.